everyone. I am Dr. Tahir Hussain, consultant physician at Ashwin's Hospital, Somajipura. Today I am going to talk about some common misconceptions about diabetes. Basically, diabetes is a lifestyle problem. It occurs due to the imbalance between the physical activity and the diet. So, one common misconception that patients have is that if I have no symptoms, why should I take medicine? Usually diabetes does not cause many symptoms. Symptoms may be very vague, like some increased passage of urine or slightly increased appetite or slight weight gain. But not many symptoms will be there. Still, if you are diabetic, you should take medicines to keep your sugars under control, because the raised blood sugars are what cause the damage in the body. Then another misconception is that if a patient takes medicines regularly, they don't need to follow a proper diet. This is another common mistake, because diet and exercise, these are integral parts of the treatment of diabetes. There should be a healthy diet divided in 3 meals and 3 snacks per day, and regular physical activity. If the patient is sedentary on office job, then they should take some time out, at least 30 to 40 minutes per day, at least 5 days in a week, for some physical activity, some aerobic exercise. It will help in maintaining the blood sugars better, and it will increase the effect of the diabetic medicines. Then another common misconception is that patients think that the diabetic medicines will harm their kidneys or other organs. The diabetic medicines are very safe. They have been tested in the market for years together, and it is not the medicines that cause the problems. It's the raised blood sugars for a long time, say 5 years, 10 years, which cause the damage in the kidneys or other organs. So definitely, if you are diabetic, you have to take medicines regularly and on the advice of your doctor. Another common myth is that sometimes patients need to be on insulin injections, and they think that if we start taking insulin, then we may need to keep continuing it, because body will get dependent on it. This is really not true. In some conditions, sometimes insulin may be required. Suppose like if you are going for a surgery, or if you are having any acute infection, you are admitted to a hospital for some acute problem. At that time, in such situations, the tablets will not work very well. So insulin injections are required to control the crisis period. And after the crisis is controlled, or after the surgery is done, you can switch back to oral medicines or tablets. It is not necessary that once a patient is started on insulin, he will have to be on insulin lifelong. Another serious myth about diabetes is that only overweight people will get diabetes. It's true that many overweight people are diabetic, but some people who are diabetic can be slim also. Patients with normal weight can also get diabetic. Then another very serious problem is that many people think that Ayurvedic or homeopathic or other types of medicines can cure diabetes. This is definitely false. Any person claiming that they can cure diabetic are false. Diabetic is a chronic problem. It is a lifelong, it is a lifestyle disorder, basically, not a disease. You have to take medicines regularly. You have to follow a proper diet, a regular healthy exercise, and when you follow a healthy lifestyle, you can certainly minimize the medicines required. For persons who are taking 4 tablets without any proper lifestyle, may get reduced to only 1 tablet if they follow proper diet and exercise. But definitely you will need some medicines. It's not curable. There is no cure for diabetes. Another thing is that many people think that since there are no symptoms or anything, diabetes is not a serious disease. This is a very big mistake. Diabetes is a very serious problem. Uh, the raised blood sugars, which over the years slowly they cause the damage in the organs, the kidneys, the heart, the eyes, the retina of the eyes, the feet. Their feet may get chronic ulcers. Sometimes that may lead to amputation and all. So diabetes can cause many complications if not managed properly. So definitely you have to take medicines regularly, follow a healthy lifestyle, a proper diet, and regular physical activity, and keep consulting your doctor at regular intervals, at least once in 3 months. Another another one common misconception is that a person with diabetes cannot take any sweets or other foods. A person with diabetes definitely has to avoid some sweets, but when they are well controlled with diet, exercise, and regular medications, they can take some sweets once in a while. You don't have to go off all sweets. So you can take once in a while some the sweets. The main thing is that it should be a small quantities. Okay. So in conclusion, for diabetes, most important things are a healthy diet, uh, keeping a watch on your carbohydrate intake, taking less carbohydrates, and regular exercise, some form of aerobic exercise, at least 20 to 30 minutes daily, at least 5 days in a week, and regular consultation once in at least 3 months with your physician. Thank you.